So, did you hear about that study on COVID-19 infections in France? It's pretty eye-opening.
Oh, the one about social deprivation affecting infection rates. Yeah, what's the gist of it?
Well, basically, they found that people living in the most deprived areas had higher COVID-19 incidence and positivity rates, but lower testing rates.
Wait, so they're getting sick more often but getting tested less?
Exactly. It's wild, right?
hmm
They used this thing called the European Deprivation Index to measure how deprived an area was.
Right, and they looked at data from May 2020 to April 2021, didn't they?
Yeah, that's the time frame. What's interesting is that during the second and third lockdowns, the disparities remained.
Wow,
So, the lockdowns didn't bridge that gap.
that's concerning. Do they talk
Yeah.
about why testing rates were lower in deprived areas?
They suggest it might be due to structural barriers to healthcare access.
Right.
Plus, people in these areas might have jobs that don't allow them to work from home, increasing exposure.
It's like a double-edged sword. Higher risk, but less access to testing.
Exactly, and this might reflect lower health literacy or mistrust in the healthcare system.
hmm
It's a complex issue.
You know, it's kind of like having an umbrella in a storm, but not being able to open it.
Yes, that's a great analogy.
Thanks.
The resources might be there, but they're just not accessible for everyone.
So what do they recommend? Any solutions proposed?
They emphasize the need to account for social determinants in public health strategies,
Yeah,
like improving access to testing and tailoring communication to these communities.
but do you think it's just about access, or is there more to it?
Well, I think access is a big part, but also trust and awareness.
Right.
If people don't trust the system, they might avoid getting tested.
That's a fair point. But we also can't ignore personal responsibility. People need to take charge of their health.
True, but if the system isn't user-friendly, it's hard for people to engage. It's a two-way
Yeah.
street.
Absolutely. It's like trying to navigate a maze without a map.
Right. And the study highlights that without considering these inequalities, national policies might actually widen the gap.
Exactly.
So, there's a real urgency to address this.
It sounds like there's no one-size-fits-all solution.
Definitely not.
Mhm.
Strategies need to be adaptable and sensitive to the needs of different communities.
Well, hopefully, this research will push policymakers to take action.
Let's hope so. It's crucial for managing not just this pandemic, but future public health crises as well.